Health Watch is presented by UMass Memorial Health Care. Here, caring for you.
Welcome to Health Watch, presented by UMass Memorial Health Care. Today, the topic is peripheral artery disease.
The peripheral artery disease is the accumulation of cholesterol and atherosclerosis within the blood vessel that can reduce the amount of blood supply provided to your lower extremities. It can affect up to 8.5 million people in the United States. And its prevalence is actually, in patients over 60 years old, can be as high as 12% of the population.
What are the symptoms of peripheral artery disease?
Classically, the first set of symptoms is pain with walking or during exercise. As the muscles are demanding more oxygen as you move your lower extremities, you're not able to deliver that oxygen due to the narrowings in the blood vessels that provide the circulation to that area. The first thing we recommend is that if you're experiencing pain when you walk, or even more severe symptoms where you have pain when you're not walking, or even an ulcer in your foot, is to be examined by your nearby physician who may refer you to a specialist. There's some medical management, including starting an aspirin or a cholesterol medication. By far the most important medical therapy would be to discontinue tobacco products. And then there are avenues for potential surgery if that's necessary.
And what are the treatments?
The first line of therapy is typically done medically, making sure you're on the right cholesterol medication, you're being treated on an aspirin, as well as discontinuing smoking. However, in severe situations, even if patients were to have symptoms, they may need surgical reconstruction either way.
How does surgery help?
There's a couple different avenues to perform surgery for this. It's simply designed to improve the blood flow down to the lower extremity. There's different ways involving stents or surgery, but it simply means to improve the oxygen delivery to the legs.
How does the Limb Preservation Center help patients?
So the Limb Preservation Center is designed for patients with peripheral artery disease or diabetes that have significant pain or ulceration in their legs due to the peripheral artery disease. So we employ a multidisciplinary model where we communicate with your diabetes doctor, the infectious disease doctor, a podiatrist or a prosthetist to develop an entire treatment plan for you in order to optimize healing of the wound and prevent recurrence.
What's new in research of peripheral artery disease?
There's new medications as well as new surgical devices that have been employed nationwide as well as here at UMass. And the other avenue is that there's certainly clinical trials which are ongoing, including at our institution, that can reduce your risk of long-term ulceration and prevent recurrence as well. We communicate directly with the Diabetes Center, and if there's a patient that they're concerned of, they come to see us and we determine what surgical therapy would be needed, if at all, or potentially enroll them in a clinical trial. First step is prevention. And so patients with diabetes are at increased risk for ulcerations on their legs, and that's related to an increased risk of atherosclerosis, so the cholesterol accumulation within the blood vessel, as well as neuropathy of the leg, where they can develop numbness in the foot just related to severe diabetes. And that can cause actual structural changes in the bottom of the foot that can increase the risk of a diabetic developing an ulceration. So we recommend daily foot inspections as well as serial examinations with a podiatrist.
How can exercise benefit those who suffer from peripheral artery disease?
That's one of the first steps of that medical therapy we discussed. We talk about recommending approximately 30 minutes a day of walking 5 days a week if possible to try to improve the blood supply to the lower extremity.